What are EPO versus POS health plans? Imagine choosing a health plan that fits your lifestyle and budget perfectly. Today, we're breaking down to popular options, EPO and POS plans. Knowing how they work can help you pick the right one for your health needs. EPO stands for Exclusive Provider Organization. With this plan, you must use doctors, hospitals, and specialists within the plan's network. Outside the network, coverage is usually not available unless it's an emergency. You don't need a referral from a primary care doctor to see a specialist within the network. EPO plans tend to have larger networks than health maintenance organization plans, but smaller than preferred provider organization plans. They often cost less than preferred provider organization plans, but more than health maintenance organization plans. If you want more provider choices than an HMO and prefer not to get referrals, an EPO might be a good fit. On the other hand, POS plans are a mix of health maintenance organization and preferred provider organization plans. With a point-of-service plan, you pick a primary care doctor who manages your health and gives referrals to specialists. You can see out-of-network providers, but it will cost more, and your out-of-pocket expenses increase. You get some coverage outside the network, unlike an EPO, but it's more expensive. Referrals are required to see specialists, similar to an HMO, but the option to go outside the network adds flexibility. The main difference is how they handle networks and referrals. EPO plans only cover in-network care unless it's an emergency, and you don't need referrals to see specialists. POS plans cover both in-network and out-of-network care, but out-of-network visits cost more, and you usually need a referral from your primary care doctor. Cost is another factor. EPO plans tend to have lower premiums than preferred provider organization plans, but higher than health maintenance organization plans. POS plans usually have moderate premiums but higher out-of-pocket costs if you go outside the network. For Black communities, understanding these differences helps in choosing a plan that balances cost, provider options, and access to specialists. If you want more provider choices without needing referrals, an EPO could work well. If you prefer more flexibility to see out-of-network providers and don't mind higher costs, a POS plan might suit you better. Think about your preferred doctors, your budget, and how often you see specialists to make the best choice.